Hello, my name is Gabrielle Rascon and I'm a representative of Heritage Sierra Medical Group. We are a 5-star network of 450 plus primary and specialty care providers. Local care is our priority, and that's why today's topic is so important. We've noticed a trend in our communities where more and more seniors ages 65 plus are choosing to retire early. Whether you're tuning in at home or on the go, I'm happy to say that today we'll cover everything you need to know if you're facing an early or unplanned retirement. Here with us today is an experienced professional, Jason Vallejos, a licensed agent from Syndicated Insurance Agency. Hi Jason, how are you this morning?
I'm doing well, Gabby. It's great to be here and I'm ready to share everything I know about retiring as seamlessly as possible. I've seen it time and time again where folks aren't aware of deadlines, penalties, and the best choice for them on Social Security and healthcare coverage.
You know, I've heard retiring isn't as easy as we think, and I'm grateful to have you here to walk us through the process of those deadlines.
Absolutely. As a licensed agent, I'll break everything down into simple steps so that everyone tuning in can have a reference where they're at in the process.
Well, I'm ready. Let's get started.
Are you considering an early or unplanned retirement? Take comfort. We're here for you. Retirement and healthcare are connected more than you think. Everyone's care options and retirement needs are different. That's why I highly recommend that if you have any questions, you connect with a professional. As a reference, you should never pay for any review of your coverage options. This should always be free to you at no obligation.
Thank you, Jason. These days, it's tricky to know a good resource when you have one. That's why we host these seminars so our communities can be informed on accurate information. Before I forget, it's important to know that Jason is an independent licensed agent. That means he's licensed with most healthcare plans to ensure that you're in the best possible option for your needs. Not all licensed agents are independent.
Thank you, Gabby. And not all agents understand the importance of connecting with folks even before they consider retirement. For all those working folks, it's important that you're aware of all options, even if you're still employed. Employer health benefits may even be more expensive than Medicare.
Really?
Yes, really. In times of uncertainty, if you've encountered a loss of employment and/or health benefits, you need to review your Medicare options to make an educated choice, especially if a change can help minimize healthcare expenses without affecting coverage. Before I get started, you need to know how to qualify for Medicare. Medicare has authorized new affordable benefits. To qualify, you must be a U.S. citizen, age 65 or older, or permanent resident for 5 consecutive years. If you're turning 65, you can enroll if it's 3 months before your 65th birthday. There are programs designed for people with limited income and resources. Call me. If you need additional details, I'll be happy to help.
That's very thoughtful of you, Jason. For those of you learning about Medicare Part A for the first time, can you give me a little bit more information about the qualifications?
Of course. Here's 3 things about qualifying for Medicare Part A. That most people don't know, persons who have paid into Social Security for a minimum of 40 quarters, 10 years, are also eligible. Eligible beneficiaries who have paid into Social Security for 40 quarters pay no premium for Part A, but you must make a selection if you want Parts B, C, and D. And last but not least, if you don't qualify on your own, you can use your spouse's work history.
Okay, Jason, that's a bit of information to handle.
Here's a quick recap. Medicare can be confusing. I'm a licensed agent working with Medicare plans for over 20 years. I'm here to answer any questions you have about Medicare.
Okay, first question. What are the A, B, C's, and D's of Medicare?
Folks and Gabby, here's what it all means. Medicare Part A, B, C, and D. Medicare Part C or Medicare Advantage plans include Part A, hospital coverage, Part B, doctor outpatient services, and Part D, prescription drug coverage. Part C is an all-in-one with no need for supplement coverage.
I'll be honest, the equation does help. But as someone working alongside our clinical team, how does this affect the doctors or prescriptions?
Ladies and gentlemen, that means that you get prescription drugs included in most plans with low to no plan premiums. Additionally, no or low copays. As far as for the doctors, I have access to local providers or doctors, so even if you don't have a doctor in mind, I can help guide you in selecting one that's the best choice for you. If you're worried that making any change is going to affect your medications, don't. I'll sit with you one-on-one to help you review your Medicare options with the medication you're currently taking. All meetings and calls are one-on-one with me for privacy, so we get to review everything just one-on-one and make sure that everything is cost efficient.
What's one of the more noteworthy benefits that you've seen?
Some benefits covered by Medicare Advantage Plans Part C. Here's what I can tell you now. I don't want you to miss this. One of the benefits you may qualify for is the monthly reimbursement for outpatient services, which means cash in your pocket once a month from certain health plans. You can also get reimbursement or coverage for hearing aids, eye exams, glasses, and hear this. Some plans reimburse for over-the-counter items. This includes items you buy from the pharmacy like Band-Aids, aspirin, and cotton balls.
That's good to know. Are there any other important benefits to consider?
Yes, of course. This is a takeaway you want to remember because it's so important. I'm going to say it one more time. There are health plan coverage options that offer some of the following benefits: lower no plan premiums, deductibles, or co-insurance copays with included drug coverage.
Wow, correct me if I'm wrong, but for those working, there's opportunities out there for health coverage with more benefits?
Gabby, Medicare Advantage plans can give you some of the benefits I discussed at no additional expense. Lots of people forget or aren't aware of the benefits that you qualify for under Medicare Advantage plans. And it's a missed opportunity to have more comprehensive coverage. I know that sounds too good to be true, but these plans are authorized by Medicare as Part C. As someone who has contributed to Medicare for all of the years that you've worked, at age 65, you may qualify for traditional Medicare Part A benefits. However, Medicare has also provided multiple options for your consideration.
Jason, you've made it clear that it's best to get professional assistance to make the right choices. But what resources would you recommend for learning more?
You can always access Medicare.gov, the official website for Medicare from the U.S. government. If you need a helping hand, I'm just a call away. I know we already discussed some of the benefits covered by Medicare Advantage plans, but with the difficult challenges experienced today, you can enjoy benefits like home-delivered meals and travel to and from medical appointments. Some plans also include health coverage when you travel. Additional benefits offered by some health plans include low to no plan premiums, low to no plan deductibles, low to no co-insurance or copays, monthly reimbursements for outpatient services, prescription drugs, travel to and from medical appointments, hearing aids, exams, screenings, routine eyeglasses, eye exams, over-the-counter reimbursement, home-delivered meals, gym memberships, worldwide emergency room service coverage.
The message I want those watching this program to understand: in difficult and challenging times, there are affordable options for comprehensive healthcare coverage. Thank you so much, Jason, for joining us today. It was a real treat to see how affordable Medicare can be.
I'm so excited to be here and tell all the viewers about my experience. Everyone, I hope you have learned how Jason can give you peace of mind and assist you with making the right choice for affordable, hassle-free health coverage. If you're like me, knowing that you won't have to go out of the area or travel a distance to a doctor or to a hospital should you need it is very important and comforting. Once I met with a professional like Jason, my husband and I actually realized a $10,000 annual savings from our previous health coverage when we switched from traditional Medicare and a supplemental plan to Medicare Advantage plan, which is called Part C. I know that sounds extraordinary, $10,000 savings, but I'm here to tell you that was the real truth. We are able to select a preferred pharmacy and save thousands of dollars of out-of-pocket costs for copays for drugs that were covered but had a copay in my previous plan. I never had to make a change of one doctor. All the doctors we were using were available to me with Heritage Sierra Medical Group. Trust me when I say it's important to stay connected to your doctors all the time and to work with the best doctors possible, no matter what your health condition. I want you to be able to be comfortable and learn a lot about Heritage Sierra Medical Group. Thank you for listening to me today.
Thank you, Ina. It's a pleasure to have you share your experience. I am blown away by the cost savings you had. Thousands of dollars in savings is nothing to take lightly. I stand by you on the importance of working with the best doctors. We at Heritage Sierra Medical Group were awarded and recognized in the Medicare Advantage 5-star reporting of physician organizations. We're a local network of 450 plus primary and specialty care providers exclusive to the Santa Clarita and Antelope Valley. That means no traveling into the San Fernando or Northridge areas. We offer completely local care. Just like how it's important to work with the best of the best, it's just as needed to work alongside a qualified professional to review your coverage options. Jason represents multiple carriers. That's important to you because he can help you select the best plan for you. Please don't miss the opportunity to review your Medicare benefits and coverage one-on-one with Jason. It's been a pleasure to have you with us today, and I'm so excited that we learned so much about Medicare and affordable coverage options.
Well, thank you, Gabby. It's been a pleasure talking to everyone today, and I can't stress how important it is that you get a hold of me so I can assist you with all your specific needs. Everyone is unique, so let's have a one-on-one conversation. And again, thank you for visiting us today.
Thank you, Jason. And for those tuning in at home, thank you for listening. Until next time.